Imagine a young boy named Lebo living in the heart of Namibia. He loves to run barefoot on the warm, red sand. One day Lebo notices something strange. Thin, red lines snake across his soles, intensely itchy. His worried mother takes him to the local clinic. Nurses suspect a parasitic infection common in the region. These infections pose significant health risks, especially for children. Lebo's story highlights the importance of public health and education. The culprit behind Lebo's discomfort lurks in the soil he loves to roam barefoot on. Microscopic hookworm larvae, too small to be seen by the naked eye, thrive in warm, moist environments. They lie in wait, hidden in the earth, especially in areas contaminated with human or animal feces. These parasites are masters of deception, entering the body through unsuspecting bare feet. When Lebo walks on contaminated ground, the hookworm larvae sense his warmth and burrow into his skin. They begin a relentless journey, creating those telltale tracks as they migrate through the skin's layers. These tiny invaders are relentless in their pursuit of a host. They thrive in areas with poor sanitation where open defecation is common. Poverty-stricken communities often lack proper toilets and sewage systems, creating a breeding ground for these parasites. The warm, moist climate of tropical and subtropical regions provides the perfect conditions for hookworm larvae to flourish. Children, often playing barefoot in contaminated soil, are particularly vulnerable to these infections. At the clinic, healthcare workers examine Lebo's feet carefully. The red, itchy lines, known as creeping eruption, indicate a parasitic infection. These lines are tracks left by hookworm larvae tunneling through the skin. The medical team may take a skin scraping or stool sample to confirm. Samples are examined under a microscope to identify hookworm eggs or larvae. In Lebo's case, the diagnosis is clear: cutaneous larva migrans. This highlights the prevalence of parasitic infections in resource-limited settings. Lebo's story underscores the importance of early diagnosis and treatment. Cutaneous larva migrans is a parasitic skin infection caused by hookworm larvae. These larvae typically infect dogs and cats, but can also infect humans through contaminated soil. The larvae penetrate the skin but can't complete their life cycle in humans. They wander in the skin, causing intense itching and red, raised lines. This condition is common in tropical and subtropical regions. Raising awareness and promoting preventive measures is essential. Section 5. The journey back to health. Thankfully, cutaneous larva migrans is treatable. The doctor prescribes Lebo and antiparasitic medication, usually in the form of a cream or oral tablets. The medication targets the hookworm larvae, effectively killing them and halting their migration through the skin. Within a few days of starting the treatment, Lebo feels a noticeable difference. The intense itching subsides, and the red lines on his feet begin to fade. The medication works quickly to eliminate the parasites, providing much-needed relief. However, the treatment doesn't end there. To prevent reinfection, Lebo's mother is advised to keep his feet clean and dry and to discourage him from walking barefoot, especially in areas where hookworm larvae may be present. Lebo's recovery is a testament to the effectiveness of available treatments and the importance of seeking prompt medical attention. His story emphasizes that with proper care and preventive measures, we can overcome these parasitic infections. Section 6. Shielding ourselves from tiny threats. Preventing hookworm infections requires a multi-pronged approach, addressing both personal hygiene and environmental factors. Simple measures can make a world of difference in reducing the risk of infection. Wearing shoes, especially in areas where hookworm larvae may be present, creates a physical barrier between the skin and the contaminated soil. This simple act can significantly reduce the risk of infection. Proper hand washing, particularly after contact with soil or before eating, is crucial. Washing hands thoroughly with soap and water helps remove any potential contaminants, including hookworm larvae. Disposing of human and animal feces properly is essential in breaking the cycle of infection. Access to latrines and sanitation facilities is crucial in preventing the spread of hookworm and other parasitic infections. By adopting these preventive measures, we can create healthier environments and protect ourselves and our communities from these preventable infections. Section 7. A global health challenge. Lebo's experience sheds light on a much larger issue: the global burden of parasitic worm infections. These infections, often neglected, pose a significant public health challenge, particularly in low-income countries. The World Health Organization estimates that over 1.5 billion people are infected with soil-transmitted helminths, including hookworm, worldwide. These infections are most prevalent in tropical and subtropical regions with poor sanitation and hygiene. The impact of these parasitic infections extends far beyond individual health. They contribute to malnutrition, anemia, and stunted growth in children, hindering their cognitive and physical development. These infections perpetuate the cycle of poverty, impacting education, productivity, and overall well-being. Addressing this global health challenge requires a concerted effort from governments, healthcare providers, and individuals. Investing in public health infrastructure, improving sanitation, and promoting hygiene education are crucial steps in combating these preventable infections. Section 8. The importance of clean water and sanitation. Access to clean water and sanitation is fundamental to human health and well-being. Yet, billions of people worldwide lack access to these basic necessities, increasing their vulnerability to parasitic worm infections. Without proper toilets and sanitation facilities, human feces contaminate the environment, providing a breeding ground for hookworm larvae and other parasites. These parasites then find their way into water sources, contaminating drinking water and perpetuating the cycle of infection. Investing in water and sanitation infrastructure is crucial in breaking this cycle. Providing access to clean water sources and safe sanitation facilities can significantly reduce the incidence of parasitic worm infections and other waterborne diseases. Governments, NGOs, and international organizations must work together to improve water and sanitation infrastructure, particularly in under-resourced communities. Sustainable solutions, tailored to the specific needs of each community, are essential in creating lasting change. Section 9. Breaking the cycle of poverty and parasites. Parasitic worm infections are intricately linked to poverty. These infections thrive in conditions of poor sanitation, inadequate water supply, and limited access to health care, all hallmarks of poverty. The consequences of these infections, including malnutrition, anemia, and stunted growth, further perpetuate the cycle of poverty. Children suffering from these infections are more likely to miss school, experience learning difficulties, and have reduced earning potential later in life. Breaking this vicious cycle requires a multi-sectoral approach. Improving access to education, healthcare, and economic opportunities is crucial in empowering communities to escape the clutches of poverty. Investing in early childhood development programs, providing nutritional support, and creating income-generating opportunities can make a significant difference in breaking the cycle of poverty and parasitic worm infections. Section 10. Education, the most powerful weapon. Knowledge is power, and in the fight against parasitic worm infections, education is our most potent weapon. Educating communities about the importance of hygiene, sanitation, and preventive measures can empower them to protect themselves and their families. School-based health programs can play a vital role in raising awareness about parasitic worm infections. Teaching children about proper hand washing, the importance of wearing shoes, and the dangers of open defecation can have a ripple effect, spreading knowledge throughout communities. Community health workers can also play a crucial role in educating individuals and families about preventive measures. By providing culturally sensitive information and addressing local beliefs and practices, they can promote behavior change and reduce the incidence of infection. Empowering communities with knowledge is essential in creating sustainable solutions to the challenge of parasitic worm infections. When people are equipped with the right information, they can make informed decisions that protect their health and well-being. Section 11. A future free from parasitic worms. Lebo's story is a reminder that parasitic worm infections, though often neglected, are a significant public health concern. These infections cause immense suffering, particularly in the world's poorest communities. However, there is hope. With concerted efforts to improve sanitation, hygiene, and access to health care, we can make significant strides in reducing the burden of these infections. Investing in research and development of new and more effective treatments, as well as diagnostic tools, is crucial. Developing vaccines against these parasites would be a game changer in the fight against these debilitating infections. Let us work together to create a future where every child, regardless of their socioeconomic background, can live a healthy and fulfilling life, free from the threat of parasitic worm infections. Lebo's story is a call to action, a reminder